All right, so my client is doing self-treatment for that three-dimensional pattern of the pelvis that we actually call right anterior ilium. But again, it does not, in my definition, does not imply an ilium rotating on the sacrum. That's a traditional perspective, but it's been disproven. This is just the whole pelvis moving in a three-dimensional manner and then having a lack of movement in the opposite direction. So you're hugging your right knee to the outside of your right shoulder. So let's go ahead and put your leg down, put both legs straight. And we sometimes find muscle inhibition with this pattern. We sometimes find inhibition of the gluteus maximus and sometimes of the gluteus medius. So I'm palpating those shelves, and they are more symmetrical. Okay? There could be a subtle difference that I'm not able to perceive, but they certainly look more symmetrical. And now I get easy movement when I push posteriorly at a 45-degree angle, and then I add an extra spring after I've taken up the slack after the initial motion stops. And I achieve this with about 15 pounds. I used to practice on a bathroom scale. And now I'm going to thrust it with an additional 15 pounds, and it moves and it bounces right back. Okay? So we've altered movement of your pelvis with that simple self-treatment.
Wow.
So you don't have to be dependent on coming to see me regularly for me to treat this pattern.
I do enjoy your company.
Okay.
You know, it is kind of expensive to fly here.
Yes, you flew in from Oregon?
Yeah, Oregon.
Yeah. Lie on your stomach? Well, why did you fly here from Oregon?
Because nobody in Oregon has been able to figure out what's wrong with me.
So now looking at those posterior iliac shelves, they certainly look to be much more symmetrical. And now we have inferior mobility. So my curiosity is, I wonder if this changes how you feel when you walk. You want to walk down the hall and come back?
Yeah, that feels a lot better. You know, this leg kind of felt almost like a peg leg.
Oh, really?
You know? It was like, it felt, you know, because I think it was bound up. You know,
Uh-huh.
It felt like I was, you know, dragging one leg.
Okay.
And now it feels like both legs are working symmetrically.
Nice, nice. And prior to filming this film, we did treat your left knee. Your patella was compressed because your hip flexors were tight. You had no hip extension.
Yeah.
And we restored that.
Yeah.
So that explains certainly the restoring hip extension on the left side freed up the patella.
Mm-hmm. Yeah.
And so that's why the left felt better, but this helped the right feel better?
Mm-hmm. Yeah, yeah. Yeah, it'll be interesting walking around the rest of the day and see how I do. But what you were saying about the glute medius, you know, being inhibited, I actually had a nerve conduction test done on me where the right glute medius was operating at like 25% of the left. It was severely inhibited.
Interesting.
So,
interesting.
Yeah.
Alrighty, well this is a nice example to demonstrate, and thanks very much.
Oh, yeah, thank you.